us discuss a little bit about the disorders of puberty. We already discussed about normal puberty in the chapter on growth and then development puberty. Okay, so now moving to the disorders of puberty. Now, the puberty can either come earlier than usual time, that is called precocious puberty, or it can come later than the usual time, that is called delayed puberty. Now, we already mentioned that breast development is the first sign of puberty in girls, and what is the first sign of puberty in boys? It is testicular enlargement. Okay, so breast development beyond Tanner stage 2. So breast development beyond Tanner stage 2. Remember, we do the Tanner staging or SMR, sexual maturity rating, to know the sexual development of adolescents. And the adolescent age group is 10 to 19 years. Very good. Okay. So, breast development beyond Tanner stage 2. And testicular volume in boys, of course, we are talking about testicular volume. And what is the device which you use to measure the testicular size? It is a orchidometer. So, testicular volume beyond 4 ml indicates the onset of puberty. Okay. So, let us discuss a little bit about precocious or early onset puberty first. So, we will see when do you call it precocious puberty and some important causes of precocious puberty in girls, some important causes of precocious puberty in boys. Okay. So, first coming to what is the definition of precocious puberty? When do you call it precocious puberty? So, definition of precocious puberty. So, we call it precocious puberty in girls if the onset of puberty is before 8 years of age. While in boys, if it is at less than 9.5 years age, then we call it precocious puberty. So, precocious puberty is defined as onset of puberty before the age of 8 years in girls and 9.5 years in boys. Okay, 8 years in girls and 9.5 years in boys. Okay. Now, there are two main types of puberty. So, one is central precocious puberty, okay, and another is peripheral precocious puberty, right? So, two types are central precocious puberty Central precocious puberty is mediated by the center, okay. So, it is also called hypergonadotrophic, okay, causes. So, central precocious puberty or gonadotrophin dependent puberty, right. So, central precocious puberty or gonadotrophin dependent. Or it can be peripheral precocious puberty or gonadotrophin independent, okay. So, it can be peripheral precocious puberty or it is also called gonadotrophin independent, right. Independent. So, let us discuss about some important causes of precocious puberty in girls, okay. Before that, remember that precocious puberty as such is more common in girls, okay. So, precocious puberty is more common in girls. Precocious puberty is more common in girls. Again, among the two types of precocious puberty, the central precocious puberty is again more common in girls than peripheral precocious puberty, okay. So, central precocious puberty is again more common in girls, okay. Now coming to some important causes of precocious puberty in girls. Okay, etiology in girls. Right. So it can be idiopathic, where you do not get any specific organic cause. Okay, idiopathic. And 90% cases of central precocious puberty in girls are idiopathic. Okay, while organic causes are more common in boys, idiopathic is more common in girls. Okay, idiopathic in girls, right? Then it can be due to infections like TB, meningitis. Okay, TB, meningitis. It can be due to injuries. Okay, so trauma, neurosurgery, radiotherapy. So injury including trauma, neurosurgery, radiotherapy. Tumors like hypothalamic hamartoma. Okay, so tumors, example, hypothalamic hamartoma. So hypothalamic hamartoma is a condition where, along with precocious puberty, you will get seizures and there are incessant episodes of laughter. So the child will suddenly, all of a sudden start laughing. Ha 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 ha. So that is called gelastic seizures. It is a type of seizures which, presents as incessant episodes of laughter. Okay. So it is called gelastic seizures. Incessant episodes of laughter is there. Okay. Apart from that, the central precocious puberty can also be due to some CNS malformations. Okay. So some CNS malformations like arachnoid cyst, septo-optic dysplasia, hydrocephalus. Okay, like arachnoid cyst, hydrocephalus. Okay, then there's something called septo-optic dysplasia where a lot of midline defects can be seen. So septo-optic dysplasia. Okay, so these are some causes of central precocious puberty or gonadotrophin dependent precocious puberty in girls. Coming to some important causes of peripheral precocious puberty or gonadotrophin independent causes. So these include hypothyroidism. Okay, hypothyroidism, ovarian estrogen excess, which can be seen in conditions again like Macunet-Albright syndrome. So ovarian estrogen excess, which can be seen in an ovarian cyst, ovarian tumor or Macunet-Albright syndrome. Okay, this Macunet-Albright syndrome is due to a stimulatory protein that is there. Okay, so this Macunet-Albright syndrome, you get a triad of precocious puberty. Okay, so there is a triad of precocious puberty, okay, cafe spots, and some bony changes, which is called polyostotic fibrous dysplasia. Polyostotic fibrous dysplasia. And it is basically due to a somatic activation mutation of the stimulatory G protein. Okay, so this Macunet-Albright syndrome is due to a somatic activating mutation of stimulatory G protein. The endocrine abnormalities seen in McCune-Albright syndrome include, so one of course is, so the endocrine abnormalities which are seen in McCune-Albright syndrome include precocious puberty, hyperthyroidism, rickets, Cushing's syndrome. Okay, so hyperthyroidism, rickets, growth hormone excess, precocious puberty. So a lot of endocrine problems can be seen in McCune-Albright syndrome, a very important disorder for you, where you can get these cafe-au-lait spots. Can you appreciate this hyperpigmented spots shown in the picture, which are the cafe-au-lait spots? So McCune-Albright syndrome, classically you get a triad. So McCune-Albright syndrome, you get a triad of precocious puberty, cafe-au-lait spots, and polyostotic fibrous dysplasia or bony changes, and this is due to a somatic activation mutation of the stimulatory G protein, and other endocrine abnormalities also you can get here, that is hyperthyroidism, rickets, growth hormone excess. Okay. So coming to some important causes of peripheral precocious puberty that we were listing down. So this includes, so one we said is hypothyroidism. Another important condition is ovarian estrogen excess. Okay. Then there can be adrenal estrogen excess as well. So the source of excess estrogen can be adrenals also. So adrenal estrogen excess, or it can be exogenous estrogen exposure from outside some drugs. Okay. Right. So coming to the etiology of precocious puberty in boys. So etiology of precocious puberty in boys. So again, there can be central causes or peripheral causes. Okay, central or gonadotrophin dependent, peripheral or gonadotrophin independent. So there can be central or peripheral. So among the central causes, the etiology is same that is in girls. So remember the etiology in girls. So that is idiopathic infections, injuries, tumors, malformations. IITM. Okay. So the central causes remain the same in boys, but the only difference is, in girls, remember the idiopathic causes were more common, while in boys organic causes are more common. Okay. So organic causes are more common. Okay. Well, peripheral precocious puberty is mainly due to excess of androgen production. Okay. Either by the adrenals or by the testes. So excess androgen production gives rise to peripheral precocious puberty. Excess androgen production from testes or adrenals with prepubertal LH levels. Okay, so the gonadotrophin levels are remaining normal. Right. So important causes include, the excess of androgens can be produced from the adrenals, as you saw in congenital adrenal hyperplasia. Remember, in the conditions where we were getting ambiguous genitalia in females, that was due to androgen excess. Now, due to the androgen excess, like you saw in 21 hydroxylase deficiency or 11 beta hydroxylase deficiency, males will have normal genitalia at birth, but at puberty, they can have precocious puberty. Okay, because of the excess of testosterones. So, CAH due to 21 hydroxylase or 11 beta hydroxylase deficiency. Okay, or 11 beta hydroxylase deficiency. In fact, the CAH due to 21 hydroxylase deficiency or 11 beta hydroxylase deficiency, the CAH is the most common cause of peripheral precocious puberty in boys. Okay. So the CAH is the most common cause of peripheral precocious puberty in boys. Okay. Peripheral precocious puberty in boys. Okay. Apart from that, the excess androgen production can be due to adrenal adenoma or carcinoma. Okay. So adrenal tumors like adenoma or carcinoma. Testicular tumors like germinoma or seminoma. Okay. So testicular tumors like seminoma or germinoma. Okay. Then it can be because of testotoxicosis, where there is, activation of the LH receptors. So it can be due to testotoxicosis, where there is activation of LH receptors. Okay. Leading to excess production of testosterone. Then HCG producing tumors like hepatoblastoma. Okay. HCG secreting tumors like hepatoblastoma or germinoma. Or there can be exogenous testosterone exposure. Okay, exogenous exposure of testosterone. Some testosterone creams are available. If you apply that, that also can give rise to it. Okay. So exogenous testosterone exposure or androgen exposure. Okay. So these are some important causes of precocious puberty in boys. So the central causes are similar to girls, but organic causes being more common. Peripheral causes can include those conditions where there is excess production of testosterone either from the adrenal glands or from the testis. Okay. So you have source from some tumors. So CAS due to 21 hydroxylase deficiency, adrenal tumors, testicular tumors, testotoxicosis, HCG secreting tumors, and exogenous androgen exposure. Now coming to the diagnosis, LH is a better indicator of pubertal status than FSH. Okay. So the diagnosis, so one thing we need to remember is LH is a better indicator of puberty than FSH. Okay, so LH levels in the pubertal range, that means more than 0.6 usually. So LH levels more than 0.6 milliunits per liter or LH FSH ratio more than 1 indicate the onset of puberty. Or LH FSH ratio more than 1 indicate the development of puberty. In addition, in precocious puberty, you will also get advanced bone age. If the child's age is 6 years, you may get the bone age as 8 years. So advanced bone age you can get in precocious puberty. Okay. So advanced bone age can be seen. And of course, we have to check the thyroid function. You have to do the imaging of the brain, adrenals and testes to rule out any tumor. Okay, so imaging to rule out tumors is important. CNS or gonadal tumors. CNS, gonadal or adrenal tumors. Okay. Of course, MRI is a better diagnostic modality, right? Now the treatment, once there was a question in AIMS exam on the treatment of precocious puberty, what drugs you will use. So usually the drugs that are used are called GnRH agonists. Okay, GnRH agonists are useful. So in the treatment of precocious puberty. So one is of course the treatment of the underlying cause. If you have got an underlying cause, you have to treat it. Like if there's a tumor, you surgically remove it. Okay, so treatment of the underlying cause. If there's a hypothyroidism, you treat the thyroid problem. So treatment of the underlying cause. So treat the underlying cause. Okay, example surgery for tumors, and you use long-acting GnRH analogs. So long-acting GnRH analogs like leuprolide. Okay, right? If there's a thyroid hormone problem, you give thyroxine replacement. Okay, and you may use some aromatase inhibitors if required, right? Depending on what exactly is the problem. So that is about precocious puberty in children. So moving on to a little bit about delayed puberty. Okay, so precocious puberty we said was more common in girls, but delayed puberty is more common in boys. So delayed puberty. Okay, it is more common in boys. Now, how do you define delayed puberty? So let us see the definition of delayed puberty. So definition. In girls, it is defined as lack of secondary sexual characters by the age of 13 years. Okay. So lack of secondary sexual characters by 13 years age, or absence of menarche by 16 years. So lack of secondary sexual characters by 13 years age, or absence of menarche by the age of 16 years, or within 5 years of onset of puberty. Okay, or within 5 years of onset of puberty. While in boys, delayed puberty is defined as absence of pubertal changes by the age of 14 years. Okay, absence of pubertal changes, that means testicular enlargement, by 14 years of age. So in boys, it is defined as lack of pubertal changes by 14 years age. Okay, so lack of pubertal changes by 14 years of age in boys. Now coming to some important causes of delayed puberty. Now delayed puberty again can either be hypergonadotrophic or hypogonadotrophic. Okay, so delayed puberty etiology. So etiology of delayed puberty. So it can be hypogonadotrophic hypogonadism or hypergonadotrophic hypogonadism. Okay. So it can be hypogonadotrophic. That means gonadotrophic hormones are less. So low LH and FSH levels. That means some problem at the level of hypothalamo-pituitary axis. So hypogonadotrophic hypogonadism. Or it can be hypergonadotrophic. Okay, or it can be hypergonadotrophic. Hypogonadism. Okay. Now this hypogonadotrophic hypogonadism can be due to some transient conditions, okay, or it can be some permanent causes. Okay, so it can be due to some transient conditions or permanent causes. So transient conditions or some permanent causes, right? So transient conditions include systemic disorders, any chronic systemic illness like chronic kidney disease, chronic liver disease. Okay. So transient conditions would include chronic systemic illness Example, chronic kidney disease, chronic liver disease, celiac disease. Okay. Severe malnutrition can give rise to it. Severe malnutrition. Some endocrine causes like hypothyroidism, type 1 diabetes. Okay. So endocrine causes like hypothyroidism, type 1 diabetes, hypothyroidism, type 1 diabetes. Now, permanent causes of hypogonadotrophic hypogonadism can include either it can be isolated delayed puberty or it can be multiple pituitary hormone deficiency. Okay. So, it can be either isolated delayed puberty, isolated hypogonadotrophic hypogonadism, or it can be multiple pituitary hormone deficiency. Okay, multiple pituitary hormone deficiency. So, isolated causes would include some genetic causes like which can be due to mutation of several genes like CAL1 gene in the Kallmann syndrome. Okay. So, mutation, genetic mutations which involve genes like CAL1 in Kallmann syndrome. Okay, GnRH receptor gene. Then mutation in DAX1 gene. Then some genetic syndromes like Prader-Willi. Okay, Prader-Willi, Prader-Willi syndrome, Lawrence-Moon syndrome. Okay. Multiple pituitary hormone deficiency, we already saw the causes like injury, infiltration, trauma. Okay. So, multiple pituitary hormone deficiency, we already know some of the causes like injury due to surgery, trauma or radiotherapy, infiltration by tumors like LCH, Langerhans cell histiocytosis, then tumors like craniopharyngioma. Okay. Then genetic causes, malformations, genetic causes where PROP1 gene can be involved. Okay, LH gene can be involved. Malformations like septo-optic dysplasia, holoprosencephaly. So, malformations. So, these are some important causes of hypogonadotrophic hypogonadism. So, we saw some transient causes like chronic systemic illness, severe malnutrition, endocrine causes. We saw some permanent causes which are mainly some genetic causes, okay, which can cause isolated delayed puberty or hypogonadotrophic hypogonadism, or there can be multiple pituitary hormone deficiency, which we already discussed when we were discussing the pituitary disorders, but it includes causes like injury, infiltration, tumors, genetic causes and malformations. Now, you know, these causes of hypogonadotrophic hypogonadism are almost same in both boys as well as girls. But the causes of hypergonadotrophic hypogonadism, that means the problem is at the level of gonads. In that, the causes are a bit different in girls and in boys. Okay. So, in hypogonadotrophic hypogonadism, remember what will happen to the LH FSH levels? They will be low. Okay. LH and FSH levels low. While in hypergonadotrophic hypogonadism, you will find high LH and FSH levels, and the problem is at the level of gonads. Okay, in hypergonadotrophic hypogonadism. So, let us look at some important causes of hypergonadotrophic hypogonadism in girls and in boys. Okay. So, coming to the important causes in girls first. So, in girls, the causes include gonadal dysgenesis, like you get in Turner syndrome. Okay. So, gonadal dysgenesis, example Turner syndrome. Steroidogenic defect, defect in steroid synthesis at the level of adrenals. Okay. So, steroidogenic defect. Example, star deficiency, aromatase deficiency, okay, 17 alpha hydroxylase deficiency, aromatase deficiency, 17 hydroxylase deficiency. Ovarian insults, which can be due to surgery or radiotherapy, okay, ovarian insults, ovarian insults which can be due to surgery or radiotherapy. Autoimmune ovarian failure or LH and FSH resistance at the level of receptors, okay. So there can be autoimmune ovarian failure, or there can be LH and FSH receptor resistance. LH and FSH receptor resistance. Receptor resistance. Okay. Now some important causes in males would include conditions like Klinefelter syndrome. Okay. So in males, conditions like Klinefelter syndrome, where you get 47XXY, right? Because there is a Y chromosome, so it is seen in males only. So in boys, you have conditions like, so chromosomal abnormalities like Klinefelter syndrome, steroidogenic defects like, again, the star protein deficiency or 17 alpha hydroxylase deficiency. So steroidogenic defects, example, 17 alpha hydroxylase deficiency. Then testicle insult to the testes, like ovarian insult you had in females, so insult to the testes in males, which can be again due to chemotherapy or surgery or trauma. Okay, so testicular insults due to trauma, chemo or radiotherapy. Okay, trauma, chemotherapy, radiotherapy. Then some malformations like cryptorchidism. Okay, malformations like cryptorchidism. Then there can be inefficient testicular action. So if there is 5-alpha reductase deficiency, okay, so the active form of testosterone is not getting formed. So inefficient testosterone action can be there. So inefficient testosterone action as you get in 5-alpha reductase deficiency. Or there can be resistance to testosterone action at the level of receptors, that is called androgen insensitivity syndrome. Okay, so resistance to testosterone action at the level of receptors, that is called androgen insensitivity syndrome. Androgen insensitivity syndrome. Okay, so these are some important causes of delayed puberty. So we saw some hypogonadotrophic causes of hypogonadism and we saw some hypergonadotrophic causes of hypogonadism. So in girls, we saw causes like gonadal dysgenesis or Turner syndrome, right? So we saw gonadal dysgenesis or Turner syndrome, then we saw steroidogenic defect, ovarian insults, autoimmune ovarian failure, LH-FSH receptor resistance. In boys, we saw chromosomal causes like Klinefelter, steroidogenic defects, testicular insults, inefficient testosterone action, resistance to testosterone action at the level of receptor. So whenever an adolescent presents to you with delayed puberty, first thing you do is you rule out systemic causes. Then you do the LH-FSH levels, okay, and you do the karyotype, because some chromosomal defects like Turner syndrome and Klinefelter syndrome are very important causes, okay. So the investigations that you do or you approach them is screen for systemic diseases, because they are very important transient causes. So screen for systemic diseases, do FSH levels and karyotype, okay, LH-FSH levels and karyotype. These are some things that you must do, okay. And because sex hormones are deficient in them, you need to start hormone replacement therapy in them. But you start it beyond the age of 12 years in girls and 14 years in boys, because the major concern is if you start earlier, then it may impair the height growth also. Okay, and osteoporosis and all has to be prevented, so you have to initiate it anyways. So the treatment is hormone replacement therapy to be initiated beyond 12 years in girls and 14 years in boys, to initiate and maintain the sexual characters and prevent osteoporosis. To initiate and maintain sexual characters and to prevent osteoporosis. So that is about delayed puberty.